Jorge Castañeda. I'm an economist with the Mind, Behavioral, and Development Unit at the World Bank. Welcome to this session where we'll be presenting a diagnosis toolkit that we have developed over the last few years. But before we start, we wanted to give you some ground rules just to make sure that we don't have any issues with the connection or anything. So I'm going to ask you all to keep your microphones muted, also your camera off if possible, just to avoid any issues regarding bandwidth and connection. Also, if you have any questions, please feel free to write them on the chat. We will try to answer them as we go, but also we will have some minutes at the end for question and answer. Before we get started, I wanted to ask you a few questions. So I'm going to share my screen and you'll be able to see the presentation that we have prepared for today. So just 1 second as I make sure we have the slides. So here it is. Please let me know if you are able to see the slides. Lauren, are you seeing them? Excellent. Thank you so much. Okay, so before the proper introductions and allowing Lauren also to introduce herself, can you please go to this website, pollev.com/POVGP. Going to leave it right there so you can enter that on your browser. And please answer the question that will come up in just a few seconds. I managed to activate it. There it is. So you have a question right there. Could you please answer it? "24 results so far." It seems it's working. Anyone having trouble? Okay, so let me show you the results that we have so far. Here it is. So United, I guess that's United States. There you go. So UK, United States, USA, Canada, majority from Canada. That's the largest chunk of the participants. Norway, Belgium, Netherlands, Switzerland, France, Brazil. So welcome all of you. Indonesia, Bahrain, France, Italy, India. So all over the world, I think. There's no participation from Latin America, just me. Germany as well. Great. So welcome you all. I'm gonna put another question to you before we get started. So you can go to the same website if you have it open. You'll see another question. The question is, in what policy area or field do you work? So please go to the same website, pollev.com/POVGP and submit your answer. In what policy area or field do you work? 7 results, 9 results, 10. Okay, let's see how it looks so far. Behavioral, gender, crisis, environment, student, migration. Okay, there's more diversity in this. This is very interesting. Food, government, psychology, SDC, change, which is very generic, conflict, masters. So I'm guessing there's a lot of it. People in academia doing their studies, health, environment again, development. Okay, very good. This is very interesting. We have a nice assortment of different profiles. Last question on this icebreaker. So go back to the same website, and now you will be able to see the third and last question. What's your role within your organization? 7 responses, 8 responses. Okay, we have a nice sample to start showing the results. Almost everyone already. Manager, okay. Advisor, researcher, student assistant, policy consultant, I guess, analyst, intern, researcher. Okay, so a lot of researchers, a lot of advisors, some managers, some analysts. We have a head, just generic head, director, and so on and so forth. Okay, excellent. Very nice to meet you all. We both now have a sense of what is it that you do, and what's the field you're working on. And with this nice icebreaker, I'm going to allow Lauren to start the presentation. A pleasure to be here. Lauren, all yours.
Great, thank you, Jorge Luis. Hi, everyone. As mentioned, my name is Lauren Manning, and I am the Senior Behavior Change Advisor with Mercy Corps. But I have also been a consultant and collaborator with the eMBeDd team at the World Bank for the last 3 years. So I'm excited to join today to be part of sharing this diagnostics toolkit with you. Could we go to the next slide, please? So as mentioned, we have a couple of different activities today. We'll share a little bit of an overview about the eMBeDd unit, introduce you to what we mean when we talk about behaviorally informed diagnostics, and provide some examples of activities and tools to help you go through that process yourself. We'll follow that up with some examples of case studies of this process in action, share some concluding thoughts, and also have an opportunity for a question and answer session. As mentioned, you're welcome to include questions in the chat throughout the presentation, and we'll do our best to answer them. But depending on who's presenting, we may not always be able to see those questions right on time. Next slide, please. Thank you. So first of all, the Mind, Behavior, and Development Unit at the World Bank, or eMBeDd as we've been referring to it throughout this presentation, is the World Bank's Applied Behavioral Science Unit. So we're housed within the Poverty and Equity Global Practice at the World Bank. And essentially, we exist to be able to incorporate behavioral science approaches, both within World Bank operations and projects, but also with direct engagement with government, policy decision makers, and other partners at scale to support them to apply a behavioral lens to their work. Next slide, please. So eMBeDd has existed for 5 years and is currently composed of 17 team members. The team has 78 partners and clients and numerous collaborators like myself. The team has been working in 80 countries and with 90 projects. And this behaviorally informed projects span across sectors, as you can see here on the right of your screen. So all of us who are working in behaviorally informed policy and development programming recognize that the successful outcomes of our work are often deeply related to being able to change and influence and impact human behaviors. So this can include a lot of things, including in the health and well-being space, where you might try to support people to make decisions to consume more nutritious food or grow in confidence related to vaccines or proactively access preventative care. But what this can also look like within topics such as effective organizations is interventions that reduce complex processes or ultimately increase staff motivation to drive stronger delivery. Or something that we'll talk about today is that behavioral projects can often be cross-cutting. So the extended case study that the Behavioral Diagnostics Toolkit we're going to share centers on looks at the intersection of climate and environment and natural resource management and gender equality. Next slide, please. So eMBeDd works currently in every region around the world and across multiple themes. So as mentioned, today's conversation will focus on behavioral diagnostics, but this overlaps as well with other areas that the team works on. So while we're focusing specifically on the systematic process of behavioral diagnostics, the tool that we're sharing today is innately a public good. It's something that will be open source that you can take and bring back to your teams to engage in this process yourself. Also has a direct relationship to evidence and institutional capacity and learning, where teams continue to grow and develop their own abilities to lead and drive on behaviorally informed policy. Next slide. Great, thank you. So another piece that's important to mention is that the behavioral insight space continues to evolve. So many of you might have been exposed to and familiar with the concept of individual nudging. So what we try to do is go beyond that, building up on a history of considering the application of nudging and then behavioral diagnostics to public policy, but building on that ultimately to expanded public policy, which involves the integration of behavioral sciences at scale. So behavioral diagnostics fits within this as an underlying approach that helps us really figure out what's happening in an individual context, why people might be behaving in a certain way. When we mean that we're thinking about expanded public policy, this means drawing on a range of fields, including economics, psychology, cognitive science, neuroscience, as well as a range of theories on decision-making, organizational and group behavior, and many more, with that deep consideration of how context impacts how a person might respond to a policy or program. When we think about individual nudging and we think about some of the more preliminary experiences and exploration of behavioral science and policymaking, some of those contextual elements, aspects of culture, aren't necessarily considered as deliberately as they necessarily could. So following through on this process with behavioral diagnosis at the root, but moving up to a broader exploration of tools available lets us think about those drivers from the earliest stages of a program and project design. Next slide, please. So the way that eMBeDd works is using a behavioral design process that is based on 5 different stages. So this behavioral approach, if any of you have also been exploring the UN's recent release of the Practitioner's Guide on Getting Started with Behavioral Science, you'll see a similar model presented there. That's something that's shared by a range of institutions that are doing this work with a little bit of variation depending on the resource that you're looking at. So one thing to emphasize is that this process really starts with defining a problem as a specific behavior. So here we identify the problem, the stakeholders, the relevant behaviors, and some of the contextual details that need to be changed in order to achieve our desired programmatic or policy outcome. The next stage is proceeding to behavioral diagnostics, which is what we're centering our conversation on today. So this is really a key moment where we zoom in to start to think about the bottlenecks that are keeping the stakeholders of interest from doing the desired behavior. So here you start to think about what's happening. What are the psychological and contextual concepts that might explain the issue, and start to identify ideas and seek method research to figure out how to solve them. Moving on from this second stage is when you get to the design part of the process. So here you're designing an intervention, which is essentially a program or a policy solution that is targeted to address that reduced set of barriers that you diagnosed in the last stage. And then finally, after designing solutions, potentially thinking about the plausible range of solutions that you might test, we'll move to implementation and evaluation. So here, the solutions that you've previously identified in the design stage are provided to a sample of the target population to see whether or not they're effective on improving the outcome of interest, where that outcome of interest is ideally measurable behavior change. Typically in this process, the evaluation is paired with rigorous methods like a randomized control trial or some type of experiment to uncover causal impact. And then finally, we get to the adapt stage, which you see in the middle here. So this is where we look at all of our initial assumptions, we look at the lessons learned from the diagnostic design and implementation and evaluation stages, and think about if we can replicate our solution at scale or where we might need to revisit this process and shift things in order to see the impact of our intervention. So one thing to note is that there are a few important features of this process. First of all, there's significant emphasis on these first two steps of defining and targeting your problem and diagnosing and exploring barriers. These are pieces where you'll put a significant amount of time and attention to make sure to capture as much accurate information as possible about the behavioral problem of interest. We really want to get our assumptions right from the start in order to generate the right solution. So we don't want to get to a point down the line where we're implementing a less effective solution just because we made incorrect assumptions or because we're realizing our mistakes too late. Another important part about this behavioral design process is the fact that it is intrinsically iterative. So as you can see, the implementation period here will often test several interventions. So they're based on different assumptions about the choices, the decision-making power and abilities, and the behaviors of your population of interest. And then you get into the adaptation stage to feed into a new process round based on those learnings of testing a few options of what might work. And then finally, this is a learning process in and of itself. So by bringing together all different types of information, knowledge, experiences of both your participants and community members who might be impacted by a policy or a program, as well as the experiences and insights of your design team, you're continuing to learn about what might work in that particular context to drive positive behavior change. So I'll pause here and turn back to Jorge Luis to introduce the behavioral diagnostic process.
Thank you so much, Lauren. And after that great introduction of the approach we followed at eMBeDd and many other institutions follow, I wanted to first get to answer the question of what is a behavioral informed diagnosis? Why is it different from other processes, other approaches that many people use? So there's three main categories that differentiate behavioral informed diagnosis for any other type of diagnosis. But more importantly, I think what's very much important to highlight is what is it used for? So as Lauren mentioned, and something to stress is that what we want out of a behaviorally informed diagnosis is to try to come up with solutions and a different approach to finding those solutions. That is the main difference with any other type of assessment when you're thinking about a policy challenge at the end. So in content, the behavioral diagnosis is very much similar to a standard analysis of what we call structural challenges. You might think of structural challenges also as systemic challenges, things that are related to institutions, to information challenges, to economic resources, incentives, and regulatory frameworks as well. So that's also included in the behaviorally informed diagnosis. It also includes social dynamics. That's an important component, and understanding these factors and what these factors are allowing or preventing, it's also part of the diagnosis. So anything that has to do with norms, not exclusively social norms, but any type of norms, what we call mental models, and also the interaction between stakeholders in the form of networks is also part of this diagnosis. But I think the most important value added, which you might know so far, hello? There's someone that is unmuted. Could you please mute yourself? Thank you. It's precisely the psychological aspect, and not only psychological, but drawing from many different disciplines, which we will see later. For now, you might be familiarized already with the concept of biases, psychological biases, either individual or social, preconceptions, belief systems, heuristics, and so on and so forth. That's the first category. The second category is about the process itself. How is it different? It is very much context-driven. That is at the heart of any behavioral diagnostic. Understanding and adapting to local conditions is very important. Trying to understand the stakeholder participation, the networks, the interrelationships, and validating that on the field is is at the heart of the diagnosis. It is multidisciplinary. As I mentioned, it draws from many different social sciences, but also data sciences. It is based on evidence. So we follow the experimental method. We draw hypotheses from data if available, and we try to validate the assumptions that we have on the field and with evidence drawn from the field. It's iterative, just like the overall approach that we follow. And we come up with priority areas. So retesting and revalidating is at the heart of the process. And lastly, the main goal out of this is trying to inform policy design and to mainstream this. So scaling up the diagnosis itself is also part of the process and part of the goal of applying it. Lastly, methodologically, there's some differences. We use both quantitative and qualitative methods. For those who are in research, they know that sometimes this is called mixed methods. We try to combine the evidence and try to come up with conclusions drawn from both approaches, but we also use the strategies, research strategies informed from a discipline called human-centered design, where the main focus of the analysis is the stakeholder of your interest. So in the case of human-centered design, it's called the user. In the case of our toolkit, we think about it as the target population or eligible beneficiaries or whatever you have as a focus of analysis. Lastly, another set of interesting methodologies that we use is the mapping analysis. In the case of policy and stakeholder, it's just, you can think about it just as simply at least trying to identify what is the regulatory framework, what are the different policies that affect the decision-making process of your stakeholder, and what are the different also actors that are interplaying in the whole environment where your stakeholder is conducting or not conducting the behavior and the interest. So those are the three main differences from behavioral informed diagnosis when it comes to compare it to any other type of diagnosis. The complementarity of the behavioral informed diagnosis is that it allows us to answer questions that are usually not posed when you're trying to assess the causes of a problem. So let me introduce you to our diagnostics toolkit. So first of all, it's a public good. It's mainly targeting practitioners and government staff. It was developed by the support of the Forest Carbon Partnership Facility, a multi-donor trust fund focusing environmental issues. So that's why at the heart of our toolkit is the fact that we want to try to understand the problems of accessing rural programs for women in forest landscapes. It was tested and validated in 2 developing countries. However, this was in the middle of the pandemic, so we found some implementation challenges that really limited that validation exercise, and is to be published in a few weeks from now. So stay tuned. It's going to be out very soon, so you can apply it yourself. It focuses on diagnosis rather than designing. Why is this important? Because in the behavioral sciences field and the applied behavioral sciences field, you'll notice that there's many different frameworks and toolkits out there that focuses mostly on how to come up with solutions. That is very important, and we really value the fact that those frameworks are out there and publicly available. But we also found that there was this gap in trying to understand the causes to the behavioral issues. So it's just one of the few toolkits out there specifically focusing on diagnosis. Second, it's focused on gender gaps, as I mentioned, and it's specific to developing contexts. That's why the validation exercise that we did was in 2 developing countries, which brings another perspective to the concepts, the behavioral concepts that you will be applying. And third, it focuses mainly as a toolkit on practical and implementation guidelines. Sometimes even toolkits are more analytical toolkits in the sense that they focus on explaining the step-by-step of analytical activities, on providing a conceptual framework, while in this case, since the idea is for people to be able to apply it on their own, in their own context to their own problems, we also focus on more practical and implementation issues, which will be shown later by Lauren. Lastly, what it features. It has 10 analytical activities that will be complemented by 10 research tools. Many of you will be are familiarized with these research tools. However, the value added here, again, is the application of behavioral concepts when using these tools. Second, what I just mentioned before, focuses and features practical tips and guidance for implementation. This is very, very important for a practitioner. And lastly, it provides, as it comes from precisely trying to understand gender gaps in forest management, it provides many examples related to this topic. One side note that is important to keep in mind. I have highlighted already the fact that the toolkit is specific to implementation. It's a guideline to implementation of research tools that apply behavioral sciences. But still the issue in terms of what type of concepts are we talking about, and how to provide at least some very basic background on behavioral sciences concepts and the theory. So we drew from the WDR 2015, the World Development and Report 2015, on mind, behavior, and society, and the three categories that are used to understanding the way humans think: the automatic thinking, the mental model thinking, and the social thinking. And we drew from the concepts that are presented there to provide some information on the main concepts, the main sources of barriers that we thought were relevant to include on our toolkit. So you can check in the toolkit that we do provide at least some sort of definitions, so people are not fishing in the dark when it comes to apply the toolkit. And it develops also several different concepts and constructs, more theoretical than anything, that are relevant when doing some diagnosis, and also the interaction between them. So you'll see, for example, that social identity, just to mention one of multiple, is at the intersection of these three main categories and not a separate concept, just to keep in mind when you're trying to analyze your results of the diagnosis. And we also provide not only these three main buckets in terms of behavioral thinking, let's call it like that, but also the fact that there are structural challenges preventing the behavior you might be analyzing. And by that, we mean contextual legal barriers and economic barriers, also informational barriers. But for the issue at stake, what we are analyzing with this specific toolkit, accessing of productive programs for rural women, we also wanted to include an extra bucket that includes as well education and informational barriers, decision barriers, and access barriers that we think are relevant when trying to identify barriers that prevent the behavior that you want to incentivize. Okay, so Lauren, back to you.
Great, thanks Jorge Luis for walking us through that. So now for the next couple of slides, we will be walking you through the general process of a behaviorally informed diagnostics. As you can see from this slide, this is presented relatively linearly. That is just more as a representation of the process. But as mentioned before, there is often a lot of space within behavioral design where you revisit previous stages, or you might find, based on your experiences and familiarity with the problem of interest, that you spend less time in certain stages. But this is generally a best practice approach, and a reminder that this toolkit is built for practitioners and other decision makers as they are growing in their familiarity with the behavioral design process. So we've been really intentional to include step-by-step guidance on how to move through this process and keep gathering, building, and reflecting on information. So to start things off, the first step is to conduct exploratory sessions. This is usually something that is pretty potentially unstructured or informal brainstorming, a chance to bring the stakeholders together who are related to the problem that you're trying to solve. So that can include clients or nonprofit partners. One best practice that I like to reflect on, especially coming from the NGO sector, is the really great opportunity to use these exploratory sessions to bring in community members and people who are most connected to the problem at hand, and see if you can make your process as participatory as possible, and really build empathy between the behavioral design team in the group who will be most connected to the problem and ultimately the solution of interest. So then the next stage after these exploratory sessions is to keep building by specifying the policy challenge and outcome of interest. So here you're starting to get more specific about the target outcome that you're looking to achieve. So for instance, in the case study about natural resource management and gender that is featured within the toolkit, something that was recognized is that there's a general challenge of women not engaging in forestry activities. But in order to get more specific, your team would go through a process of starting to think through, well, that's just a general challenge that we're seeing, but what could be at play here? So you might decide to specify that the policy challenge is that programs exist, but women simply are not enrolling. But on the flip side, a more specific challenge focused on the after enrollment stages could be they're enrolled, they're interested, they're involved, but they're not actively participating in meetings. So in this case, you'll start to think about what are we looking to achieve, moving in from that broader conversation to something more specific. And then to the third phase is just writing down assumptions about why the challenge occurs. Really core to behavioral diagnostics is consistently hypothesizing and asking why might this be occurring and where can we get the information to figure out if that is in fact the case. So here you'll think about the behavioral reasons as well as the structural reasons that could be causing the current or problem behavior, and why that continues to occur, as well as what might be preventing the goal behavior from happening. So the next phase is to identify the behaviors of interest. So again, this is getting more specific on everything that you started to brainstorm in the exploratory sessions and get more specific on in steps 2 and 3. So you're starting to ask really specific questions about what and when and where does the behavior need to take place in order for it to be sustained? Who exactly is the actor in the target population? So rather than broadly focusing on women, for instance, you might start to think about rural women or members of Indigenous or non-Indigenous groups, and how a policy or program could impact them differently. So then following on from that is a more concerted attention to exploring the context as well as researching additional evidence. So in these stages, you're going to draw on as much data as you possibly can about the specific context, including how the behavior might have been measured before. Some best practice is to look at similar interventions that have happened in other places, but it's important to remember, especially related to context, that what has worked in another location won't necessarily work in your location as well, but it might provide useful information or insight into what has and has not worked to solve the policy challenge in other settings. So within the contextual analysis and research stages, there's a number of tools that you can leverage. Those are noted here in red. Again, this is represented as a linear process, but these tools will consistently complement each other and help you gain broader as well as specific insights into the problem that you're trying to solve. So a literature and documentation review is something that you are likely already familiar with. This is an opportunity to draw on scientific evidence, different types of documents, especially if you're working with government counterparts. You might be able to rely on administrative data, or other materials that have been collected about the population of interest, and start to assess what is and isn't known about the target behavior. A second tool is a stakeholder map where you can visually depict the different individuals and institutions that have a relationship to the target population's behavior. We'll get into some details about what these tools look like, but the chance to visually map out the different networks, the connections, the levels of influence that have a direct impact on behaviors is a really powerful way to think about who is engaging and when and could be affecting individuals' decision making. Another tool is a policy map, which is a little bit narrower than the literature review and the stakeholder map. And this is assessing the regulatory framework that exists that could be impacting the behavioral problem that you're trying to solve. And then finally, you'll take all of this data that you've collected through this process and these tools, and this is going to give you space to think about all the information that you've connected, to analyze it and make sense of the content that you've gathered together as you move forward to move beyond definition and targeting and towards the behavioral diagnosis. Next slide, please. So after capturing all of this information, we get to a second phase of the process, which is the actual diagnosis as well as exploration of barriers. So you begin by outlining the decision-making process of your target audience. Individual is going to take to get to the desired behavior and thinking about the obstacles that they could face along the way. A really useful tool to do this, marked here as letter E, is the behavioral process map. It's again another way that you can visualize these steps. So we know that at each step of the process, people are going to face barriers to the goal behavior. So you get more specific by outlining their broader decision-making process and then thinking about where there are different enablers and barriers along the way. So when we get to identification and prioritization of barriers, that's really thinking about, we know all of these plausible barriers are at play and impacting how someone is making a decision and choices and conceivably could act in a certain way, but you have to prioritize within the resources, the time, the relationships that you and your team have, which barriers you can conceivably confront with your behavioral design process. Oftentimes, there are a number of barriers at play, some of which need to be confronted first or to create an enabling environment for behavior change before you can proceed to confront others. So going through this prioritization process, you move on to prepare and conduct validation in the field. So this is really a chance to think critically about who your key respondents are. Who do you need to get information from to test your assumptions and hypotheses and see if the conclusions that you're drawing about the plausible barriers and decision-making process do in fact reflect the reality of that target audience of whatever your ultimate solution might be. So for example, in the case of the toolkit, you might decide to speak to rural women about their experiences and exposure to forestry programs, but you also might need to talk to community leaders and other government and stakeholders and nonprofit organizations operating in the area, as well as talking to members of households or other networks that these women are part of. So there's lots of tools to be able to go through this process, including focus group discussions, semi-structured interviews, observations, and surveys that provide a wealth of qualitative evidence and insights directly from these populations who are impacted by or have influence over the success of your behavioral solution. And capturing these insights means that your design is more likely to have higher levels of impact. So then moving on from that, as before, we'll process our data, analyze the results, and try to make sense of the trends and the themes that we're seeing along the way. What's useful here is that the toolkit itself provides insight into the types of software that might be necessary, as well as technical needs and expected costs of going through this process, so that especially for teams who are new to the diagnostic process, there's a lot of information about how one would actually tackle these steps on their own. Next slide, please. So here on this slide, you can see a couple of examples of what the resources in the toolkit look like. On the left in blue is a sample activity sheet where the step of the process is noted right up top with bullet points outlining each step. As this says, this outlines each step of the decision-making process. The tool itself also outlines the steps that you would take to be able to complete that activity. Then in the middle is an example of one of the tools that is featured in the toolkit as well. Each provides an overview and a definition of what that tool looks like, plus step-by-step guidance on how to implement that phase of the process. One thing that's exciting about this toolkit is it's interactive. So as many of us are accessing resources digitally, there are features within the toolkit that you can see noted here in teal. So for example, you can click on that teal button that notes template of a behavioral process map, and it would open up the image that you see on the right panel. And this is an example of something that you and your team can use as a visual aid when completing the behavioral process map, and have access to that while you're navigating the toolkit. So at the point where you're seeking that information, it's readily available. There's also another example at the bottom of these pages. It's a small circle where if you click on that, that would open up a page of references. So when you're also seeking additional information about where did this tool come from, how can I find more information, what are the sources, or seeking definitions about aspects of the process, you can find those linked in the references section rather than scrolling all the way to the end of the document to find that information. Later on. Next slide, please. So again, on this slide, this is a more detailed look at what the tool guides look like. Each one provides description, requirements, and implementation details. So as mentioned, we'll re-emphasize that this is a tool for practitioners, and it's based to really think about each step of the behavioral diagnostic process and how you can implement in the moment. It's a really great tool in the sense that it also shows the strengths and limitations of each tool. This is something, again, from the practitioner standpoint, that for teams that are newly introducing themselves to the behavioral sciences and the behavioral design process, having that information that can help you make the trade-offs between each activity and recognize how you need to build your design team is a really important opportunity. And those details are featured within each tool discussion. It also includes details on the requirements that you need to have for your team. So the types of data that you might need, the basic skills that you will have in order to complete this activity, the level of effort it might require, whether or not this is something that you might want to outsource to a firm or something that you can do in-house based on the software that you have available and other skills, and other considerations such as cost, as well as the implementation steps that you will follow. Next slide, please. And here is also an example of the printable templates that are included in the toolkit. So those interactive buttons that I mentioned earlier can open up templates that your team and yourselves will be able to download once the toolkit is available. These are intentionally very simple. You can, of course, customize them to meet your needs depending on the diagnostic process you're following and the problem that you are looking to solve. But they're intentionally simple so that they can be accessed in low bandwidth environments, printed at low cost, and used very quickly and rapidly by teams who are involved in behavioral design. So this is a great way for teams to consider the information that you might need to gather in the moment when you are completing some sort of research exercise. And I'll pause there and turn back to Jorge Luis for some case studies.
Thanks so much, Lauren. We don't have so much time, so I just wanted to make sure before proceeding that we don't have any questions so far, or if you do, there's a lot of questions. And then, could you please type in the question for now? We will leave, again, some time for Q&A, but for now, could you just type it in so we can try to respond it for everyone? I just wanted to wrap up the presentation by showing you, I'm sorry, I lost the slide, by showing you the application of the toolkit, the two were the two case studies that we implemented last year, and also showing how to integrate everything that we have shown so far and how this can be used for a better design of public policy. So the two case studies were implemented in Mozambique and Nepal. I'm going to go really quick through the details of each of the projects. In the case of Mozambique, we were trying to support funding project to the government of Mozambique on a livelihoods project for the northern region. So 3 provinces in the northern region, specifically targeting vulnerable population in rural areas, and that included components for youth and gender. So that was and women, of course. The diagnostics activities were implemented between March 9 and 19. There was a previous weeks of preparation before the field work. We targeted 4 communities in 2 provinces, and we conducted 51 activities. The activities on the field were implemented by a network of NGOs with the support of the Ministry of Agriculture and Rural Development. This is one of the models of implementation of the toolkit, where we have partnered with both governments and NGOs to build their capacity in terms of the use of behavioral insights. But we have another model, which is the model that we follow in Nepal. There we try to inform 2 forest investment projects in the country that are in the process of design. It's a dedicated grant mechanism for indigenous people, local communications, and then a Forest for Prosperity project. The diagnostics activities were implemented between March 22 and April 10, 2021, and we targeted communities from 3 municipalities in 2 of the southern provinces of the country for a total of 62 activities conducted. Here, the model of implementation was simply outsourcing the activities to a research firm. They implemented the activities with our supervision, in contrast to the work in Mozambique, where we were very much involved in all of the stages on implementation. Again, just a reminder that everything was conducted in the middle of the pandemic. So we follow a very rigorous protocol for safety of both our teams, but of course the local communities. And we had to follow very strict procedures to interact with this community. So that was also very challenging in terms of the implementation remotely from our side. However, I want to show you what was the details of the tools, participants, and the content of these activities. As I mentioned, because of this implementation challenges, the scope of the toolkit that was implemented and validated was limited. We conducted only 3 of the activities of the tools suggested or provided in the toolkit, namely focus group discussions, in-depth interviews, and observation exercises. We focus these activities on female beneficiaries and non-beneficiaries, all of them part of the target population of the programs. However, in the in-depth interviews, we included some male beneficiaries. It was very important to gain their perspective as well. And lastly, also as an additional stakeholder, program staff and community leaders that are interacted with this population. In terms of the topics, of course, we base the content of these tools on the framework that I showed earlier, on mental models, social barriers, and the automatic thinking. Here we call it attention barriers because we were very specific on the concepts that were applied. But on top of that, we also covered some background information related to social demographics or participants and access to resources. And lastly, also a bucket related to program barriers, which I showed earlier as an additional category to try to understand what prevents this population for participating in these programs. And in this case, specifically, we mean any factors, any element of the design of the program that can create friction in terms of accessing the program itself. Okay. In terms of the results, and again, I don't want to spend too much time here, just to show you what sort of information can you gain from applying this type of toolkit. I have organized it in the main buckets that I just showed: structural, automatic, social, and mental model thinking. Of course, a very standard assessment of barriers and problems will give you some of these factors as result, but in terms of the structural analysis, as you would expect, limited access to financial resources and time was a common barrier to being able to participate in this type of programs. In the case of Mozambique, we started finding differences from the case of Nepal, and this only highlights the fact that this type of analysis is context-based. So the asymmetric information on participation was a barrier that was very much specific to the context of Mozambique and was not observed in Nepal. What do I mean by asymmetric information? The way the information that was disseminated about the participation in the program was different across communities, and that created an asymmetry as well in the participation. In terms of automatic thinking, I've highlighted having in bold format the barriers that were common across the two countries. Benefits misperception refers to the expectations potential beneficiaries have about participating in the program, and there was some misconception on how they could access, use, and just the amount that they were expecting to get out of the participation was not close to what was really being offered to this population. So benefits misperception is very important when, as a driver, to not participate when your expectations are not met, because sometimes misinformation, lack of awareness, and so on and so forth. But something that was different across the countries, for example, in Mozambique, we had an intention to action gap. Some of you might be familiar with this concept. Is the idea that some of these potential beneficiaries had the intention of participating, they wanted, they had the motivation, but when it came to an action, when it came to really applying and following the procedure, they didn't do it. So there was a clear intention to action gap in the case of Mozambique, while in Nepal it was not observed. I'm going to jump to the next category, just in the interest of time. In social barriers, we found across the two countries that was limited family and community support. That's something that a standard gender assessment can give you, and that you can get as a conclusion. Lack of social references was also something observed across the two countries, but a very interesting difference in the case of Nepal was the last of the three barriers that we found, and had to do with the fixed mindset about gender roles. The idea from the side of women that there are very specific roles that are linked to your gender, but more importantly, that these roles are not cannot change. They're fixed and they cannot be modified by themselves. So that was very powerful in terms of thinking about solutions as well. Lastly, mental models. There was a poor self-image and sense of agency in the case of Mozambique, very much related to another insight that we get in Nepal, related to poor self-efficacy, in the sense that some of the women didn't think they had the skills necessary to participate actively in this type of programs. Think about skills, it could be hard skills or soft skills that they needed to participate. They didn't think they had what they needed to participate. Okay, so how do we translate, and with this I finish, how do we translate this type of insights into actual solutions, which is at the heart of the diagnosis, the behavioral diagnosis? And instead of showing you what we are doing right now in Nepal and Mozambique, because that's ongoing work, I will show you an actual intervention that was created from a behavioral diagnosis in Mexico in 2017. So after following the same procedure that we just shown, and Lauren explained each of the tools and activities that we implement regularly, after that, and after gaining insights from the field, we came up with a communications campaign in a very similar program, but in the case of Mexico. And the communication materials that we created were trying to target some of the barriers that were observed, and use some of the behavioral insights that maybe you have heard about across this week during the week. So, for example, we use reminders and feedback loop in the form of SMS communications to potential beneficiaries. We also try to reduce the complexity of the procedures, and that was reflected in the informational materials of the program. We used the right messenger in the sense that we were signaling social references, role models within the community that could show potential beneficiaries how to effectively participate. And lastly, we make them trust on their capabilities, thinking about this idea of self-efficacy and what they thought they lacked in terms of participating, the skills that they needed to participate. At the end, this very simple solution, this communication activity, increased the program take-up among women from harder to reach localities. So this is a very powerful solution and very powerful outcome from a very simple communication campaign and changes to the way these messages are being shown. Okay, Lauren, so I think we can conclude with some reflections about how to apply this in your own work. So please, Lauren, go ahead.
Great, thank you. And I was just answering some questions in the chat, but wasn't able to get through everything. So I'll just point you there, Jorge Luis. So just some final parting thoughts as we wrap up Behavioral Science Week with the UN Behavioral Science Group. One thing that we found to be really exciting is being able to note that this is a really practical toolkit for our colleagues within UN entities as well as collaborators. So in general, these items presented on the slide here came from the enablers for behavioral science application from the Secretary General's guidance note. Oh, Jorge Luis, I think we lost the slides. That's okay.
They're back again.
Yes, that's perfect. Thank you so much. Yeah, I can also just keep speaking. So along these steps, there are places where the toolkit can be a really valuable entry point to achieve these enablers. So for instance, when you're looking to create a culture that supports behavioral science, the toolkit can actually be used to apply to operations within UN entities or whatever type of government, ministry, or body that you work in, to think about what might be preventing your own teams from engaging with behavioral science. It's also a great opportunity to strengthen behavioral science capacity and learn by doing. This was something that had come up in the chat, where these research tools can be used and engaged by teams working on a range of development problems, and you can apply these lessons and approaches independently. So of course, there are moments when you'll need to seek behavioral science experts and support to help you on this journey, especially in the early stages of doing this work, but it's a great opportunity to have practical step-by-step guidance that teams can take on their own as we work to expand the broad swath of people who are taking a behavioral lens to their development work. Again, it's also an open source resource. We're really looking forward to sharing it with you in the next couple of weeks that can support practitioners who are looking to strengthen their own behavioral science capacity. And great opportunity as well to think about fostering exchange and collaboration and the practical application of behavioral science. Deeply intertwined with this work is thinking about concepts such as ethics and inclusion and making sure that we are taking a lens of exploring how behavioral barriers and then the solutions that we might come up with are impacting groups that have particular vulnerabilities and that might experience a policy solution differently. So this is an opportunity as you go through the diagnostic process to think about that context and consider how you can be as inclusive in your work as possible. And again, as noted, it's customizable and adaptive. So while we shared with you some examples from gender and natural resource management, you can follow the diagnostic process and apply it to any sector that you're working in, as well as collaborate with other colleagues, either within the United Nations and beyond, to think about how you can avoid duplication and complement one another's work and learnings.
You're muted, Jorge Luis.
Thank you, Abby. I think we're right on time right now. We're trying to reply to most of the questions. So the ones that we have right here, I'll do it without actually responding on the chat. Where would you share the toolkit? Mainly on our website, worldbank.org/embed. I will type it in on the chat. Thank you for the group. Thanks so much for thanking. How can we access this toolkit? Again, at our website, it will be available by the end of this month. And then if there's no more questions, I think we can wrap up the session. Anything else, anyone? All right. So just to thank you again for participating in the session. We're very happy to be able to participate in the UN Week. And we'll be in touch. Please check out our website for updates in terms of the toolkit and other resources we might have at the World Bank. Thank you so much, everyone.